Have you noticed your hands shaking when doing fine tasks? Are you spilling things or dropping items? If so, you may be suffering from essential tremor. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Today, we'll talk about what essential tremor is and what can be done about it, including medications. Let's get started. Essential tremor is a neurological disorder that causes involuntary and rhythmic shaking. This condition can affect various parts of the body, though it most commonly impacts the hands, making daily activities such as drinking from a cup, writing, or even using a phone difficult. Other areas that may be affected include the head, voice, arms, and legs. It is important to note that essential tremor is distinct from Parkinson's disease, though they are often confused due to some overlapping symptoms, particularly tremors. However, essential tremor is a separate condition with its own causes, symptoms, and treatments. Essential tremor typically starts gradually and can worsen over time, although for some it remains mild throughout their lives. The tremors often occur during movement or when trying to perform a task, which is the key characteristic of essential tremor, in contrast to Parkinson's disease, where tremors often occur at rest. Although essential tremor can affect anyone, it is more common in people over 40, and the likelihood of developing it increases with age. The exact cause of essential tremor isn't fully understood, but it is believed to involve abnormalities in certain parts of the brain, including the cerebellum, which controls movement. Research suggests that there is a genetic component as well, meaning essential tremor tends to run in families. In fact, about half of the people with essential tremor have a family history of the condition, indicating a strong hereditary link. The severity of tremor can vary greatly from person to person. For some, the tremors are so mild that they barely notice them. For others, the shaking can become severe, interfering with daily tasks and significantly impacting quality of life over time or become more difficult to manage. For individuals living with essential tremor, it can be challenging to cope with the stigma and frustration of the condition, especially if others mistake their tremors for nervousness, anxiety, or even the effects of substance withdrawal. Therefore, raising awareness about the condition is crucial in helping people understand that essential tremor is a legitimate medical issue, not something that people can control with sheer willpower. When it comes to managing essential tremor, there are a variety of treatment options available. While the condition cannot be cured, treatments aim to reduce the severity of tremors and improve daily functioning. The treatment plan often depends on the severity of the tremor, the individual's overall health, and how much the tremors are interfering with their daily life. One of the most common approaches to managing essential tremor is medication. While medications won't eliminate tremors entirely, they can help to reduce their frequency and intensity, allowing patients to regain some control over their movements. It's important to understand that medications for essential tremor are not one size fits all. What works well for one person may not be as effective for another, so it can take time to find the right treatment plan. The most commonly prescribed medications for essential tremor are beta blockers. These drugs are primarily used to treat high blood pressure and heart-related conditions, but they've also been found to be effective in reducing tremors for many people with essential tremor. One beta blocker that is often used for this purpose is propranolol. Propranolol works by blocking the action of certain chemicals in the nervous system that contribute to the tremor. This medication is typically taken in pill form and has been shown to be effective for many people, particularly for tremors that affect the hands. However, beta blockers are not suitable for everyone. They can cause side effects such as fatigue, lightheadedness, and rarely breathing difficulties, particularly in people who have asthma or other respiratory conditions. For this reason, a doctor will carefully evaluate a patient's medical history before prescribing beta blockers for essential tremor. Another class of drugs commonly used to manage essential tremor are anti-seizure medications, also known as anticonvulsants. One of the most widely used anticonvulsants for essential tremor is primidone. Primidone works by reducing the excitability of nerve cells in the brain, which in turn helps control the tremors. This medication is very effective, but it may take a little time for the body to adjust to it, and some people experience side effects such as nausea, dizziness, or drowsiness when they first start taking it. For those who cannot tolerate beta blockers or anticonvulsants, or for whom these medications aren't effective, other options may be explored. One alternative is gabapentin, a medication that is often used to treat nerve pain and seizures. While not as commonly prescribed for essential tremor as propranolol or primidone, gabapentin has shown some effectiveness in reducing tremors in certain patients. In some cases, benzodiazepines, which are medications typically used to treat anxiety, may be prescribed to help manage essential tremor. Drugs like clonazepam or alprazolam can help reduce the frequency of tremors, particularly for those whose symptoms are exacerbated by anxiety or stress. However, because benzodiazepines can be habit-forming and may cause drowsiness, they are usually prescribed with caution and are not typically considered a first-line treatment for essential tremor. Another treatment option for more severe cases of essential tremor, when medications aren't providing sufficient relief, is botulinum toxin injections. Commonly known by the brand name Botox, botulinum toxin can be injected into the muscles to temporarily weaken them, which may help reduce the intensity of tremors. While this treatment can be very effective, it does have limitations. For example, if used in the hands, it might reduce tremors but also cause temporary muscle weakness, which could make it difficult to perform certain tasks. Nevertheless, some patients find that botulinum toxin injections significantly improve their quality of life by minimizing tremor symptoms for several months at a time. I just wanted to take a moment to ask that you hit that like button, subscribe to my channel, and leave a comment below if you have any tips for others with essential tremor. Anyway, if medications and other non-invasive treatments do not provide adequate relief, surgical options may be considered for patients with severe essential tremor. One surgical treatment is deep brain stimulation, or DBS, a procedure in which electrodes are implanted into the brain to send electrical signals to areas involved in movement control. These signals can help regulate the abnormal activity causing the tremors, leading to a significant reduction in symptoms. DBS is usually reserved for patients whose tremors are disabling and resistant to medication. While DBS can provide dramatic improvements in many cases, it is a major procedure that comes with risks, including infection, bleeding, and issues related to the implanted device. Living with essential tremor can be challenging, but with the right treatment plan, many people find that they are able to manage their symptoms and lead fulfilling lives. It's important for patients to work closely with their healthcare provider to find the most effective treatment option for their individual needs. While essential tremor cannot be cured, advances in treatment continue to improve the lives of those living with the condition. Here are some helpful tips that might help. Use heavier utensils and tools, which can help stabilize your hands. Drink beverages from a half-full glass to avoid spills. Voice-controlled devices can also be helpful, reducing the need to type or write. Living with essential tremor can be challenging, but with the right treatment plan and support, it's possible to manage the symptoms effectively. If you think you might have essential tremor, or if your symptoms are getting worse, please talk to your doctor. They can help you find the best treatment plan for your needs. Thank you for watching. As always, take care of yourself and make the most of your day.